Everyday occupational therapists across Ontario are doing awesome things. They're delivering wonderful client-centered care, designing programs that are delivering amazing outcomes, developing cool new promotions or solutions, sharing impressive resources or knowledge, undertaking dynamic entrepreneurial business development, and all sorts of other inspiring activities that we think are just awesome. We think that's worth celebrating. The Ontario Society of Occupational Therapists is delighted to invite you to join us in celebrating the awesome accomplishments of OSOT member Anne Fourt. We're excited and impressed to learn that in addition to fulfilling the roles of clinician and assistant professor, Anne can now add co-author to her list of accolades. This year, she co-authored a book called Treating the Trauma Survivor, An Essential Guide to Trauma-Informed Care. Anne believes that trauma-informed approaches should be universal. Yet too often, OTs and other healthcare professionals are not aware of the principles and do not learn the skills needed to integrate trauma-informed approaches into their practice. The book that Anne co-authored provides the practical tools and strategies to do just that. Anne hopes that all OTs will be knowledgeable about trauma-informed care and integrate these principles into their everyday practice, and as a result, not only will client care be improved, but OTs can become advocates for making the whole healthcare system trauma-informed. We think that it's awesome that Anne has identified this important opportunity to contribute to knowledge transfer that can influence how healthcare is framed and provided in Ontario. We're thrilled that this book is written by an occupational therapist and salute Anne on her commitment to share her knowledge in such a tangible way. It's our pleasure to introduce you to your colleague, Anne Fourt. Congratulations, Anne. We want to recognize your awesome act in OT. Anne, can you tell us a little bit about the book?
This book is a very practical book. It's chock full of information talking about diagnosis, but also about things that are of great concern to occupational therapists. It talks about the principles of trauma-informed care, which are very coherent with our own principles, such as collaboration, giving information, being really clear about what's going to happen, telling people what's going to happen before it happens and after, developing respectful relationships. It also provides some important psychoeducational tools that you can use with your clients. It talks about how to use grounding strategies if a client dissociates, and how to empower clients to work with you to manage their distress. It also has psychoeducational tools and deals with the question of why is it so difficult sometimes for our traumatized clients to engage in self-care in a healthy way.
And what inspired you to write this book, Anne?
I have been an occupational therapist for many years, and in my training way back when, I didn't learn much about treating people with psychological trauma. In my experience in the last 12 years at Women's College Hospital, I have learned a lot, I've taken courses, and I really want to pass that information on to other occupational therapists because, as we know, trauma survivors are everywhere. It's not just in mental health. And unfortunately, if we do not have the skills to provide trauma-informed care, we may inadvertently re-traumatize our clients in spite of our best efforts.
And Anne, do you have any imparting words of wisdom for your OT colleagues?
I would say the most important thing is to learn from your clients. They will help you, they will teach you, and you can have a great collaborative relationship with them because often they know what's helpful and what isn't helpful.
We thank you for your time and for sharing your knowledge and expertise with us today. We think what you're doing, Anne, is just awesome.